David Hess is the Dean of the Medical College of Georgia. He is kind enough to come back to us in advance of his State of MCG address. Dean Hess, thank you for being with us. We appreciate it.
My pleasure. Thanks for inviting me, Brad.
Well, I know one of the biggest topics that you're going to talk about in your address is the state of Georgia when it comes to physicians and doctors per capita. We don't have enough. And with enrollment being so impressive at MCG, why aren't those docs staying here?
Well, it's true. So Georgia is about 40th in the country in doctors per capita, and that's in the background of a severe physician shortage in the country. So we're short of primary care doctors, we're short of specialists, and particularly in Georgia, particularly in rural areas of Georgia and South Georgia, we're very, very short of doctors. So yes, we have 230 students a year, and that makes us one of the top 10 largest medical schools in the country. So we're a big school, but to train a physician takes a lot. It really takes a village. It takes a state in our case. So you have to learn 2 years of basic science. You got to learn the basic science of disease, and then your third and fourth year, you've got to get in there in trenches and get a lot of hands-on experience. You got to deliver babies. You got to put tubes down patients. You got to take care of cancer patients. You got to learn all that in 2 years, and so it takes a lot of doctors, a lot of one-on-one attention. So to be able to do that and be in Augusta, which is relatively small, we have a state of 10.4 million people, only 400,000 or 500,000 live in the CSRA. Mm-hmm. We have a distributed regional model. So we have a campus in Athens, which is 4 years with University of Georgia. Then we have a campus in Rome, the northwest part of the state, southwest in Albany. I was just there this week. Yeah. And then the southeast, we have Brunswick and Savannah. So literally, we're all over the state. And we rely on 2,500 volunteer faculty who we don't pay to train our students, in addition to about 500 or 600 full-time paid faculty.
What happens when they graduate? Are they lured away by higher pay? Do they go home, all of the above?
Yeah, so it's a good question. So after you go to medical school, you have to do 3 to 7 years of residency training. Mm-hmm. And so, studies show that where you go to medical school and where you do your residency are the best predictors of where you'll practice. Now, one of the problems is we don't have enough residency slots in Georgia, and so we lose a lot of good students to go out of state for residence. And the Board of Regents has had a plan. They put a committee called the Great Committee to actually start new residencies in hospitals that didn't have them before. So that's helped, but we're still very short.
Is it as simple as adding residencies where there are currently none, or can we expand residencies? Can we say to a doctor, take more people under your wing?
Well, we would love to expand residence here, but residencies are paid in a very complicated fashion. Mm-hmm. It's something called the Balanced Budget Act of 1997, which restrained Medicare spending, also restrained GME spending. So we're fixed at the number of residents that we had in 1997. So that really hurts us. So our hospital is way over that cap, but we have to pay for all those residents over the cap. So if we had the cap extended, and that's complicated, the state has to help, the federal government has to help, that would really help the doctor shortage.
What about your relationship with the state? Pretty good? So
it's very good.
One day we meet that goal?
Yeah, it's very, very good. They've been very, very supportive of what we're doing.
What about the department heads that you are bringing in left and right? That's got to provide a big energy boost to MCG.
Yeah, I think we're doing more recruiting of leadership and faculty, like Dr. Clausen. He's a faculty member. We've recruited, we're trying to recruit the best and the brightest, like Dr. Clausen, and mm-hmm. our leadership too. So I think we're recruiting about 10 to 12 different chairs and other leadership positions, senior associate deans, et cetera. And we filled about half of those so far.
What about the Georgia Cancer Center? We like to touch on that because it is quickly becoming a national force. How are things going there?
It's going well. It's really becoming a destination center, which means patients not just from Augusta come there, but we're getting bone marrow transplant patients from all over the Southeast, all over South Carolina, all over Georgia. We have some programs where we draw people from Europe, some of our immunotherapy programs. So we've hired, including Dr. Clausen, who's here, mm-hmm. I think 13 cancer doctors in the last 14 months. So that's phenomenal. We've more than doubled our size of cancer doctors. We're still looking for a director. We have an active search going on, a national search. We hope to name a director by the spring and have them here by next July 1st. But even without a permanent director, we're recruiting left and right.
You know, I asked you about your relationship with the state. Obviously, it's strong. What about with the federal government, and how dependent is MCG on those funds to keep us going?
Yeah, so most of our federal funding is through NIH grants and different grants. And so NIH, funding was pretty restrained for many years. Now it's coming up, and in certain areas like Alzheimer's disease, there's a lot of NIH funding. Cancer funding is still very, very competitive. So, we actually look at where we are. We've moved a little bit up in the NIH rankings. Medical schools are ranked on their funding. We've moved up a little bit. We're continuing to try to do that. But what people don't understand is research requires a lot of investment. For every dollar you get of research dollars, you have to put in $1.50 to $2. To subsidize research funding. So it takes a lot of philanthropy.
Georgia has no shortage of health issues. We're in the stroke belt. We have all sorts of health challenges ahead of us. As one of the leading institutions in the state and the country, what can we do to make Georgia healthier?
That's a great question, and you're right. We're 40th in physicians. We're between 40 and 45 in most health measures, and that's at the bottom. And it's particularly bad in rural areas and south of I-16, where we're one of the sickest areas to live, not just in the country, but in the world. Global health is South Georgia. So to address this question, one of our campus deans, Doug Patton, who's in Albany, got together with our AHEC director, Denise Cornegie. They complained about this to me. Why don't we do something? So I do what most deans do. I put them on a task force to head, and they got together members of the CDC, Department of Health, people from Mercer, Morehouse, and they've got what they call 3 game changers to start affecting public health. Now, none of these are immediate. Some is to really train, something called ECHO, to train, be a hub and a spoke, kind of CME, to train primary care doctors how to deal with things like prostate cancer or how to deal with specialty things. Another one is to work on health policy. One of the big issues in Georgia is we didn't expand Medicaid, and that's been very, very difficult. It's hurt a lot of hospitals. So by not expanding Medicaid, it's been very, very tough on indigent care hospitals and academic health centers like we are. So having a voice at the table is important. And the third thing is to work with federally qualified health centers, which we totally are siloed from in academic medicine. Federally qualified health centers are all over the state, and they deliver a lot of primary care, and we've been walled off from them. So what we're trying to do is break down those walls, work with them, do research with them, and have our students train in them more. So those are some of the 3 game changers that we're going to start with.
All right, so let's say we accomplish those 3 goals and more, and that we do continue to become this statewide force. It all starts right here in Augusta and those other campuses that you mentioned, but certainly to the largest extent here. How do you feel about class sizes? You touched on it at the top of our interview. Are they where we want to see them? Should they be smaller, bigger? How do you feel about class size?
Medical school class size.
Correct.
Well, we're actually we're planning to expand the Athens campus, and that was always in the cards.
We shouldn't be fearful of that in Augusta.
No. In fact, we want to expand here too. We're just not sure how much. We want to look at innovative ways to expand. Right now medical school is 4 years. Does it have to be 4 years? We're looking at maybe 3 years and combining it with family medicine or primary care training. But these are still things we're thinking about. We haven't implemented yet, and we'd have to get LCME, which accredits medical schools, would have to vet that and make sure we can do it. So now we're expanding Athens, and we want to expand here. We probably need to get somewhere between 260 to 300 in a class. The good thing is everybody wants to go to medical school, and we turn so many good applicants away. We lose sleep over the people, as Kelly Braun, our admissions director, says, that don't get in, because we turn many qualified students away. We get 3,500 applicants for 240 positions, and these kids are all great.
Don't most Georgia parents want their kids to go to MCG, stay here, stay close?
Yeah, they do, and it's a good buy. The tuition's less than a lot of private medical schools, and it's a great education. I think educationally you can't beat MCG. I mean, a student can come here or go to Athens, or they can go to one of our regional campuses. It's not unusual for a student down there to deliver 40 babies in a month. They get tremendous hands-on experience.
What do you hear from candidates, whether it's people being recruited for med school, or people, students, or whether it's doctors being recruited as department heads, as researchers? What do they want out of a town, and what do they see when they look at Augusta?
Well, Augusta's a place, once you live here, you never leave.
Right, it's true.
It's hard to get them to come here, and I think particularly people west of the Mississippi and in California and the Northeast, they're a little bit unsure of it. They're just not sure. A lot of them don't. They know about the Augusta National, but they don't really know much about Augusta. When they come down here and take a look, and they get a real estate tour, they look at our housing prices and our schools, All right, and then we're selling the spouse as much as we are the person. So the spouse, you know, I've learned to spend as much time on the spouse as I do on the candidate.
Yeah.
That's not as much of an issue with medical students who all want to come here, but faculty are in short supply. There's a physician shortage. An academic physician shortage is even more severe. I mean, finding specialists who do research in diabetes or Alzheimer's, I mean, they are really, really rare.
Is our town fun for students? Dr. Keel, when he was here, talked about how whether it's housing or whether it's entertainment offerings for these students to take advantage of, he wants those kind of things in Augusta. Are students happier these days?
I think it's getting better. You know, I think the married students tend to be happier in Augusta than maybe the single ones. That's what I often hear. But you know, we have a lot of students go to UGA and they get to choose the Athens and the Augusta campus. You know, they can choose. A lot of them choose Athens, but a lot of them choose here because they want Augusta. So you know, it depends upon the student.
Well, I can't thank you enough for what you're doing at MCG, and I know you touched on the highlights of your State of MCG speech, and I know a lot of people are looking forward to hearing the particulars when it's delivered, but thanks for what you're doing to put us on the map.
Thanks a lot, Brad. Appreciate being here.
Absolutely. Anytime. Honored to have Dr. David Hess, Dean of the Medical College of Georgia.